So our first module is around contraceptives. In this module, the learning objectives include being able to identify different types of contraceptives, recalling and recognizing pros and cons of each contraceptive, and also knowing where you can access these types of contraceptives and being able to integrate all of this information in order to determine which contraceptives may be useful for you in your life if applicable. So, let's start off with the IUD, intrauterine device, specifically a hormonal IUD. There are other kinds of IUDs, but in the context of this lesson, we'll be going over the hormonal kind. An IUD is a small piece of flexible plastic shaped like a T, as seen in the image on the right. Your doctor can insert your IUD through your vagina and cervix into the uterus. The hormonal IUD, as indicated by its name, uses a hormone called progestin. Progestin prevents pregnancy by inhibiting ovulation, the process that happens once every menstrual cycle that involves releasing an egg. This hormone will do two things. One, it'll thicken the mucus around the cervix to prevent sperm from entering the uterus. And two, it stops eggs from leaving the ovaries. By inhibiting the release of this egg, there'll be no egg for a sperm to fertilize. Here at CMU, you can get a hormonal IUD at University Health Services. So what are some pros and cons of hormonal IUDs? Well, they're 99% effective. We'll see that compared to some other contraceptive methods, this is one of the most effective kinds. It's also reversible, so you can have a doctor take it out if you change your mind or just want it removed. Note that you do need a provider to insert or remove it. It can also last for multiple years depending on the brand, which is much longer than some other contraceptive methods. It's also very low maintenance. Once it's in, you don't have to do anything or worry about it. It can also cut down on cramps and lighten periods, which is especially helpful for those who have heavy, painful periods. The cost is covered by most health insurances. For cons, there is some possible pain when the IUD gets put in, but usually if there's pain, it only lasts for a few days. If the pain lasts longer, definitely go see a physician about it. There could potentially be some irregular bleeding and spotting for the first few months after being inserted. It also takes some time for the hormonal IUD to work, about a week after being inserted. And finally, IUDs do not protect against STIs, so for that protection, you'll need to use a barrier method in addition to the IUD, which we'll go over later.